Good afternoon. My name is Natalia Wróblewska and I'm a Senior Project Officer for Small Steps, Big Changes. I would like to thank you all for joining us today for the launch of our Child Development Resource. Firstly, for those of you who may not know about us, I would just like to share a little bit about Small Steps, Big Changes. We are a 10-year partnership programme funded by the National Lottery Community Fund as part of their A Better Start programme. We work in 4 areas of Nottingham, which are allowed to council wards. These are Aspley, Bulwell, Hyson Green, Arboreton and St Anne's. And we work with families from pregnancy through to a child's 4th birthday. Within the UK, there are 5 A Better Start partnerships in Blackpool, Bradford, Lambeth, Nottingham and Southend. We have 3 child development outcomes. These are that children in SSBC wards have healthy, positive social and emotional development, have effective age-appropriate communication and language skills and good nutrition, and a 4th outcome of systems change. Based around these outcomes, SSBC commissioned a number of interventions and services which you can find out more about on our SSBC website. SSBC, in collaboration with colleagues from Health, Early Years Education and the local authority, are thrilled today to be able to share details of the Child Development Resource, which has been developed to support the early years sector. On behalf of SSBC, I hope you enjoy the following presentations from Donna Sherratt, SSBC Head of Programme, and Kirsty Gleedell, Public Health Coordinator for the Children's Public 0-19 Service. Donna will be discussing the background to the Child Development Resource, why it was developed and how it evolved over time, from the initial pilot of the resource with early years teams to the resource that will be made available to you all in the next few months. Kirsty will then share how the resource can support you, both on a personal level and with the families that you work with. Following the presentation, there will be an opportunity for question and answers, so please either hold on to any questions you might have until after we've heard from Donna and Kirsty, or pop them in the chat option as we go along, and we'll try and get through as many as we can in the time allowed. If we are unable to answer all questions following the session, then we'll be happy to contact you individually. Your service will receive a hard copy of the resource in June. There will be a QR code and internet link at the front of the resource, which will take you directly to our website and where you will be able to download an electronic version of the resource. Today's session is also being recorded for any colleagues who are unable to attend. This recording will be available shortly on our website, so please do let them know. Well, that's all from me. I will now pass you over to Donna Sherratt. Thank you.
Hi and welcome everybody. Thanks for joining us today. My name's Donna Sherratt and I'm the Head of Programmes at SSBC. I'm really pleased to be able to share the Child Development Resource with you today. For those of you who know me, I'm an NNEB nursery nurse, so early years practitioner as my career. And I started off in private day nurseries, so today takes me back to the roots of the complex world of early child development, which is often underestimated. I'm therefore really pleased to be able to share with you the child development tool that has been produced in partnership. Today we'll find out why the resource was developed, who was involved in its development, how it was developed, and then my colleague Kirsty will tell you about how it can be used. So if I go back to the beginning. So in 2018, Nottingham City Council, City Cares Children Public Health 0-19 Service and SSBC collaborated to deliver Giving Nottingham's Children the Best Start in Life service. This was aimed at focusing on delivering and integrating a range of existing services. To do this, there were 4 work streams: performance, places, practice and people. The people work stream identified that there was a lot of child development, a plethora of information, development opportunities available to support children amongst practitioners. However, despite this, there was potential for gaps for different workforces. It also identified that milestones for child development are also underpinned and don't sit alone from the way that their families are supported to know and understand them, referral systems, integration, and also how they're delivered with families. So the Task and Finish group reviewed the current training and partnership organisations and online resources. From that, it was identified and recommended that alongside the in-depth training around early childhood development, that a resource that practitioners could use regularly with families would enable them to pick up any challenges with regards to appropriate development stages. And this would help to increase the understanding, opportunities for observational skills, and really importantly, enable better conversations with parents around their child's development. Task and Finish group reviewed resources available to meet all of those aims. So the Task and Finish group was made up of the parents, Nottingham City Council Early Years, the integrated workforce development within Nottingham City Council Early Help, the community voluntary sector, Children's Public Health 0 to 19's nursing service, and also the private, voluntary and independent childcare sector as well. So we had a range of knowledge, experience and skills that all came together to look at the best way forward. So we're really privileged that everybody gave their time, knowledge and expertise to move this forward. As part of that, it was identified that should a new tool be required, it should be based around the EYFS development matters and centre around the home learning environment. And there should be reference to things like evidence-based programmes such as Solihull approach, Triple P, ages and stages questionnaires, big little moments, and other elements that we use in our everyday practice. Also making sure that we were really clear about attachment and the importance of this, and also adverse childhood experiences. This resulted in a group coming up with a tender to get the following requirements. So a resource that would identify key development milestones, ideas and suggestions to best support child development, an opportunity to observe behaviour and also help referrals to be made to the right teams at the right time. And as I said before, around making sure that there was attachment, but also trauma-related behaviours were identified as well. A tender was put together by the steering group, and early education were awarded the contract. So early education worked over a period of time to create the content which met all of those needs. We then had some challenges. A little thing called COVID, which had a significant impact, as we're aware. During this time, a lot of early years provisions closed during that time. The impact on capacity of the partners in the steering group in developing and rolling out the tool, the resource, meant that there was a pause with regards to how it was progressed. Also, within that time, the early years foundation stage reforms happened, and this changed the age ranges and the age bands that were within the EYFS, and therefore previously, and therefore what the child development resource was based on. But also, it was a massive shift for the early years workforce. So there was a huge amount of reforms that had to happen across provisions to make sure that it was now in line with the early years foundation stage reforms in 2021 and the guidance. There was also an identified that there was a huge amount of information of child development to fit into what we'd initially had an idea of would be a FOB, which is demonstrated on the slide to the right, actually became a booklet as well. And during this time, we also had a number of changes in the steering group membership as well. What that led us to was a finished product that we wanted to pilot. And so we were really privileged that we had a number of key partners who were able to engage in a pilot. So the pilot took place in February through till April 2022, and pilot teams were given the books and a briefing sheet to make sure that we had some really robust feedback to enable us to make any changes that would help it to be a successful tool moving forward. We had lots of different feedback from individuals, and Kirsty will cover a little bit of that in her section as we get onto it. But some of the feedback was that people really liked the ease of the diagrams, and also that it enables quite a diverse workforce to support the children, young people's child development. So from the sessions and the feedback sessions, there, as I say, there were 5 sessions held, and these were well resourced focus group sessions. So we used the opportunity to make sure that we really got down to the elements that would support the resource to be really effective, but also to make sure that it supported lots of different workforces. So we had 5 open-ended questions, as you can see here on the screen, and then the feedback sessions were supported by a research and learning officer to make sure that we captured all of the feedback, and there is a report on the findings of that. So some of the key findings were that it's seen as a professional and concise physical resource, and people really valued the high quality and the good the robust information, and felt that there'd quite often been underfunding in the early years, and it was really good to see a resource that could be trusted and used by professionals. Also felt that for experienced practitioners it was really good as an aid memoir and for quick reference. One of the challenges were if you've got less child development experience or background, that you would really need to make sure that you used other resources to help to make sure that the child development tool resource was effective. It's not meant as a standalone tool. Also, what came out, which was interesting and came from lots of different organisations, was that many practitioners felt that it was a really good resource for parents as well. It enabled them as a workforce and as a practitioner to underpin their own knowledge, but also it enabled really good conversations with parents, and that QR codes would be really useful both for practitioners and parents if they wanted to find out a little bit more information. So what does the final product look like? Some of the challenges that we had, in particular, that the original document had been written on the old EYFS. We've acknowledged this in the booklet, and the sections within the child development resource span the early years foundation stage and also the ASQ. So it's there to be dynamic and to support practitioners to use their knowledge and experience and what they're observing from the child in front of them as well. We've now got hard copies which are going to be distributed from June 2023, and colleagues will be telling you about that as part of this presentation, and it will also be supported by a launch video as well. We've got QR codes which support the last experienced practitioners and also parents, as I've said, to get further information and to fill any gaps that the child development resource might create. As I say, it's not a standalone document. And a couple of the comments were that it's a nice, little, light, concise, shiny document, and people commented that they really liked the diagrams. It was easy to understand and good to share with families, and it was also straight to the point as well. So I'm going to hand over to Kirsty now, who's going to tell you a little bit more about how this resource can be used by lots of different workforces. Thanks again for your time this morning. And I just also wanted to say a massive thanks to all of the individuals who have been part of this long journey of creating this child development resource, and really hope that it helps practitioners across Nottingham. Thank you.
Hi, my name is Kirsty Gledell. Thank you very much for that, Donna. I am a public health coordinator working in Children's 0 to 19 nursing service. I've got child development background and 23 years experience of working with children throughout Nottingham City. I've been part of the steering group that has put together this resource booklet that we're going to launch today. Part of my role in today is to talk through how to use the resource within practice across different services. So how to use the resource. So the main aim of the resource is to support staff to develop or refresh their knowledge around child development. It is to be used as an aid memoir mainly, or an evidence-based resource which can be referred to as and when required. And also hopefully we can help sort of develop observational skills and enhance an individual's practice both in the home or education settings, or in a clinic environment. So the resource will have different sort of sections within the book around physical development, emotional development, speech and language, just to name a few. So if you're on a home visit, you might actually be observing a child and you think, actually, I'm not quite sure if that child's meeting their development milestones. So you might get the book out, have a look at it, look for the age range of that child, and then just glance through and see if you feel as though that child needs a follow-up through with a more of an in-depth sort of assessment, or it might be you're able to discuss with mum or the caregiver around the child's development and try and help them support putting sort of activities and things in place. It's a simple sort of resource with lots of expected development milestones, along with information of diverse pathways of development. Now, I must stress the child development resource does not replace the assessment tools currently used within the services, such as the ASQs and the early years foundation stages, but it can be used alongside to support. So it's there to help support you make an informed decision as to when to do more of an in-depth sort of assessment as well. So during the pilot, the services across Nottingham City used the resource book in practice, and here's some of the examples of how their resource was used. So the Family Nurse Partnerships, they found actually they took it out into the homes and they found it useful to talk about some difficult sort of conversations. It helps support with the difficult conversations, maybe around physical activity, but also use the QR codes to help sort of signpost parents to get more information. The Children's Public Health 0 to 19 nursing service and the early help services. So most of the practitioners within those services use the resource more as a reflective guide to help challenge their own knowledge base and professional practice. So again, it's, as I say, you're going out on a visit, you're coming back, and you're just questioning yourself if that child's age 4 is meeting the development milestones. It's a very good quick reference guide, and it also then signposts you then to actually follow up with that family or seek more information to actually give you more of an informed decision about where to go to support the family. Okay, one of the comments was it's nice to actually have it in your bag, and, you know, think, oh yeah, right, I've just talked about you know, that particular area of development, right, speech and language. What else can I support them with today? So the early years settings, they actually found it quite useful in parents' evenings. So again, they use it as a summary to talk about where their children, the parents' children are at around their child's development. So they thought that was quite a useful reference guide to actually use to talk and explain about where their child is meeting their development milestones. And the family mentors helped with practitioners to recognise sort of what is age appropriate development, what it looks like, and when to signpost to other services for that more in-depth sort of assessment. So all in all, I think we've actually created a really lovely booklet for all services to use in slightly different ways, but mainly to help support with their sort of knowledge and skills of personal development. Thank you. I'm going to pass you over to Natalia now for some Q&A, I think.
So we have one question in the Q&A. Who and where are the resources being sent? Natalia, this is probably a bit for you. Can't hear you, Natalia.
Yep, like I mentioned in the introduction speech, following this presentation, we'll be sending out the resources to services in June, And shortly after this presentation, the actual recording of this seminar will be available on our SSBC website. Also, at the front of the resource, we'll have QR links and a direct link to the website, which will take you to a recording of this and to an electronic version of the resource. So yeah, expect to receive a hard copy of the resource around June time. Thank you.
Great, that's lovely. That answers the second question, was can I get another hard copy? But I think the answer is that probably once we've sent them out, if you can have the virtual copy, that would be great, and go onto the SSBC website. Can I use the resource to support parents in a setting?
Do you want me to answer that? I can answer that.
That's fine.
So not directly, as the resource does contain language that may not be comprehensible to some families. However, it can be adapted in your own understandable language to share and support around age-related progress to improve early outcomes. It can also help practitioners to support parents and carers by sharing ideas on how they can support their child to access learning opportunities to promote development and well-being. Or it could be an opportunity for the early year settings to put on development sessions using the content from the resource to support families of children in different age groups. And as Kirsty mentioned, the resource can support the workforce when carrying out core contacts alongside other assessment tools such as the ASQ and EYFS.
Thank you, that's great. We just had another question in, are there plans to develop one for families to use? I think the answer to that is probably not. At this stage, we're not planning on doing that. We're hoping that the settings, I think, will be using it to support parents and carers of the children that they're working with.
Yeah, that's correct.
Thank you. Oh, we've just got another one come in. Will the hard copy be sent to all services, or do we need to request one? Natalia, you've got the list.
Yeah, I've compiled a list. So it is being sent to like early help, children's public health 0 to 19 teams, family mentors. If you're unsure if you're receiving one, you are welcome to email me and I'll see if you're on the list. If not, I can certainly add you to our list.
I just want to put out there that the Children's Public Health 0 to 19 nursing service will get one from me. I'll be distributing those across the city.
Thank you.
And it's not just SSBC wards.
And I think the other thing to say is it will be going to foster carers as well as PVI settings as well, and childminders. So it will be well distributed across the whole Nottingham area.
I've tried to ensure that I haven't missed anybody and no services are missed out. So we have gone around, haven't we, to ensure that everybody does receive a copy who is eligible.
Okay, I think that's, unless anybody wants to pop another question in the question and answer box, we can move on to Hayley. No, I think that's it. Thank you, Natalia and Kirsty, for that. And we're going to move over to Hayley, who is going to just give a little bit of an update on possible CPD that you may be interested in. Thank you.
So yeah, I've just got a couple of opportunities that we wanted to let you know about. So we have got, which newly has been revised, the Think Dads training. So this is, again, like the child development resource, which is, you know, across the board. It's not just for SSBC wards. We've got the Think Dads training, which is father inclusive workforce training. So it's designed to increase your awareness of father inclusive practice. It's going to provide you with the knowledge and the skills and tools to be able to approach father inclusive practice within your workforce, in your workplace. So if you're interested in that, please let me know. We have also got, we're looking for workforce that would be interested in becoming a Healthy Start champion. So currently within Nottingham City, we've only got 68% of those eligible families that are actually claiming the Healthy Start scheme, which means there's a considerable number of families that are unfortunately missing out. So what I'm hoping to do is to look for workforce to come forward, complete the Healthy Start training. So it's just a short 20-minute session where we'll look at just increasing your Healthy Start knowledge, looking at how you could raise the awareness with families, and then where possible, hopefully support them to apply for the scheme. So if you think this is something that you could kind of fit into your everyday work, that would be really great if you could let me know. And we have also got a number of, just a small number of actually places available for the June conference, which is June the 13th, and that's the second instalment of the Trauma Informed Conference. And that is Conversations That Make a Difference. And we've got keynote speaker Lisa Cherry that's coming along. So if you would like to come onto that conference, I've just added the link into the chat. All you need to do is just add your name to that waiting list. But if you're interested in becoming a Healthy Start champion, or if you're interested in the Father Inclusive Workforce training, please drop me an email. The training can be held within your teams. So the Think Dads training could be done within teams as well, if that would be easier. So yeah, just get in touch. Thank you. And I'll just hand you back over to Natalia. Thank you very much.
Okay, I'll just okay, thank you very much. Thank you, Hayley. Thank you, Hayley, and to all of the speakers. I would like to thank you all for attending. I hope you enjoyed the session and will find the resource beneficial to support both your practice and for your own personal development. If you have any further questions, then please do not hesitate to contact us. My details will be added to the chat. Thank you and enjoy the rest of your day.